days mandatory quarantine. So this is, you know, I just think that the clear message to Queenslanders is definitely do not go to New South Wales and do not go to Victoria during this period of time. But we do wish everyone the very best, and we know that our Victorians get on top of these issues very quickly. So my final message to everyone is, of course, in Queensland we've got the week of continuing to wear our masks. Make sure you check in. That QR code is helping us to track down people who come into close proximity of others who might be infectious or close contacts. So it's absolutely vital that you continue to do that. And of course, if you are sick, go and get tested. And I thank the community for absolutely doing that. And we need to keep up that great work. So thank you, Queensland. You're doing a wonderful job. I'm very proud of everyone. And together we'll get through this. So I'll hand over to Dr. Young to go into a few more details. Thank you.
Thank you, Premier. So yes, very good news for Queensland. We just have that one positive case. So all 3 in that family are now positive. And I would just like to thank that family. They have been so wonderful. They have done everything you could possibly hope of anyone to do. So they were in hotel quarantine in Sydney, and then the mother and her son directly travelled from that hotel to Queensland. Now, we do have the whole genome sequence result from the son, and it's confirmed, very tightly confirmed, with that outbreak that's going on in the community down in Sydney. So the people in Sydney, the health staff there, will be working through how he acquired the infection while he was in hotel quarantine down there. So he's come up here and he had very little exposure out in the community. So we're just tracking through all any contacts he had while he was in the community. Then his father had minimal exposure in the community, and his mother virtually none, because she went into hospital with her son when he was admitted. So that's all good. In total, there are 62 contacts that we've found so far, and we're just working with all of those. Then the second outbreak that we have is that worker at the Brisbane International Airport. So she's a supervisor at one of the boarding gates. So we've already gone through CCTV footage and found 23 close contacts, 22 casual contacts, and we expect there'll be others. Those people have been very prompt in getting back to us. We text messaged all those people, and we'll just follow them all up today and make sure we get all their test results and that they're in quarantine. So we just have to work all that through. Now, whole genome sequencing has come back on that worker who works at the Brisbane International Airport. It is 4 SNPs different to the previous worker who works at, who, remember, worked at the airport and was positive. So that means there hasn't been direct transmission from that previous worker at the airport to this worker at the airport. There's been some other transmission that's occurred at the airport. It is also the Delta strain. So we'll have another look if we can find any other close matches, but at this stage we can't find any close whole genome sequence matches. So I'm quite convinced that we have today in Queensland 2 new outbreaks. They are not related to all of the other outbreaks that we were dealing with. All of those other outbreaks we're coming towards the end of, and I'm very confident about those. We just now need to deal with these 2 new outbreaks, which is why it is really, really important we maintain our restrictions for another 7 days. Wearing masks makes a big difference, we know that. And please, anyone at any of our airports in Queensland, domestic or international, please wear your mask as soon as you arrive at the airport. If not before, when you get onto any public transport, you must, anywhere in Queensland, wear a mask as you go through the airport, because we know it's high risk, time and time again. Thank you.
Well, fortunately, we don't have a lot of new reports of COVID-19 in Queensland. Unfortunately, Victoria can't say the same thing. The Sydney outbreak has now spread south into regional Victoria and into Melbourne. They are taking appropriate steps in order to deal with that outbreak, and we are today reciprocating those those hotspot arrangements. We do hope they get on top of those, and we also welcome the Prime Minister's decision to extend the Sydney compensation arrangements to the rest of the country. They will be now available to Queenslanders should we experience another lockdown.
So to be clear on the changes, from 1 a.m. tomorrow morning, anyone travelling from Victoria into Queensland will need to have a travel declaration and an exemption. It should only be Queensland residents who are flying in, and they will need to go into hotel quarantine for 14 days. Now, those people flying in today will still need their travel declarations, and police will be checking these at the airport. This way we can make sure we're able to contact anyone who we believe has been a close contact in any cases that might come forward. We also want to remind anyone who has been travelling interstate, whether it's New South Wales, Victoria, Tasmania, anywhere where there has been recent cases, if you have travelled in these jurisdictions in the last 14 days, including people who are flying in today, please check the website at least once a day to check for exposure sites to see if you've been there, and follow the advice in relation to those exposure sites. This is extremely important to keep us all safe, so please be checking those sites. And of course, even though our change only comes in at 1 a.m. tomorrow morning, those people flying in today from Victoria are still bound by the Victorian lockdown, so they shouldn't be flying out of that state unless they're in compliance with the Victorian lockdown directives. So we ask everyone to comply, to do the right thing. Again, the community, wear your masks, social distance, make sure good hygiene, stay home if you are unwell, and please go get tested, just as these most recent cases did. Go get tested if you have any symptoms whatsoever.
So the reminder is there, as the Minister just said, to make sure you are wearing your mask and are compliant with all our restrictions, and for those people coming into our state, understand what is required of you. 42 masks were handed out to our community yesterday. We processed 1,611 vehicles at our borders, and even though a number were turned around, it was disappointing to find that there were two where we had people coming in on false declarations, one being a 79-year-old person who's now in hotel quarantine on the Gold Coast, and disappointingly another vehicle, a limousine, where a driver and 3 passengers have also been placed into quarantine. The 3 passengers are not cooperating at the moment, so further investigations are ongoing, and the driver has been fined $4,135 for a false declaration. At our domestic air borders, 2,102 passengers processed, 11 turned around and 104 into quarantine, and we saw 170 international arrivals yesterday, and we did issue another penalty infringement notice for not wearing a mask after a person was given an opportunity, so a $206 fine. That's a reminder for everyone. You will be given the opportunity. Do the right thing. We need you to do that. Thank you. Out of New South Wales hotspot.
Right, that means that she didn't get it from that person, but there's been a common ancestor somewhere. So that there's been some case somewhere that has branched out into different ones. So I would suggest the most likely, but I have no evidence, is that there's been someone who's transited through the international airport who's been infectious, possibly a flight crew member, and has passed it on. But it's not someone that we've tested here in Queensland or Australia.
Apologies if this is already happening, but are we considering bringing in rapid, testing for those workers, those border workers at the international airport?
No, because it's not as accurate. So we do, of those people most at risk, we test them each day and then get those results. But the most important thing to do is what that worker did. As soon as she developed the first sign of any symptoms, she came forward and got tested. She was excellent. No. No, it doesn't. By common ancestry, we know that the first case clustered most closely, it was quite a distance, but with cases in India, because we can go on to the international database for genome sequences and look around the world where there might be something. So we think that's what's happened.
And with transmission at the MCG in Victoria, doesn't this then raise more concerns about stadiums and the safety of these football matches that will take place in Queensland?
That's a very good point to bring up. The most important risk is when people are mingling before they go to the stadium. Once they're seated, we can then work out who's seated around them. So the most important thing is you need to put your mask on as soon as you leave your home to go to any of these matches, and not take it off until you are safely seated in a seat. And then once you stand up, immediately put it back on again. That's the most important thing, because we know where people are sat in stadiums. The stadiums have been extremely good in their plans. I've not got concerns. We can contact trace, we can manage, but we have no idea when people get onto public transport who they've been with. I mean, TMR have been great in giving us data that they can when people swipe in, but it's much, much harder than people on the street. We don't know. Sometimes we've got CCTV footage, usually we don't. It's very hard. Once they get to the stadium, that's the easiest part of the whole process. So really, put your masks on as soon as you leave your home. Don't take them off till you sit down in the stadium. I don't have it on me. New South Wales will be looking into all of that, and we should leave them to go and do an investigation as to how things might have happened and what other risks there might be in their hotel. All of us are now very good at doing that, at sorting through whenever there's a potential escape of the virus in a quarantine hotel, to then look at the circumstances around it.
Of the young families of NRL players haven't been allowed in at this stage. What more information do you need, and is it more of a, you don't want to see these scenes giving preference?
Oh, no, I just need a plan from them. I don't even have a plan as to which hotel they'll use. So I just need a plan, which hotel, how it'll be managed. I need all the staff in that hotel vaccinated. I need all of that work done, and they just haven't had a chance to do any of that. So once they've done all of that, and I've had the opportunity to make sure that that plan meets all my very, very strict requirements, then we can work together to sort it out. So no, they have not been told that the families can't come to Queensland, but we do need a proper plan, and that plan needs to ensure that no Queenslander is at risk, and also that the Queensland taxpayer doesn't pay for any of the costs associated with it. Could I just apologise? My head is just COVID. I'm not sure that I can give a good response. I haven't been involved, so it's not about what my view is. I just have not turned my mind to it. I know an enormous amount of work has been done in the department and a lot of consultation, and it would be far better putting that question to someone who's been involved. Sorry. I just haven't turned my mind to it, truly. I'm dealing with this outbreak to the best of my ability. Thank you.
Just on this current outbreak, considering we, located this family really quickly, there was a worker really quickly, are you, feeling good about the fact that maybe this won't be a bad one, or is it still too early to say?
It's far too early to say. This is the Delta variant that has spread very, very rapidly within Sydney. And no matter how good this family has been, which they have been, that's not sufficient. We know it can get out. So all of us need to take this extraordinarily seriously for the next 7 days, and I will know within the next 7 days whether we're facing a significant risk or not. Just the next 7 days, please, everyone take this very, very seriously.
Why are you so comfortable with
Yeah, thanks. That's a really good question too. So, look, like I said, we meet every morning with Dr. Young. She looks at all of the sewage testing in New South Wales, and don't forget they're in lockdown, and it has not gone beyond that sort of Greater Sydney area. So, and the areas that they have already declared as hotspots. So we are monitoring it very, very closely. I can absolutely assure Queenslanders that.
And just to confirm, it's the entire state of Victoria?
Yes, yeah, because they've done the lockdown for the entire state.
And there's still a lot of hospitality businesses and the live music industry is hurting as well with the limited capacity. What do you say to them?
The live music, we just signed off the other day in terms of the $7 million being released, which is fantastic. And just in terms of, I think National Cabinet's considering today that they've actually reduced the period for compensation or an arrangement between the state and federal to 5 days. So I think those discussions will happen this afternoon. I don't want to preempt those discussions in National Cabinet.
Given the fleeting nature of the way that Delta can jump from person to person,
Yeah.
are you confident the settings that are in place are hard enough given that we've had 3 Delta cases who have had some community exposure?
Yes, because we know that the masks and the check-in apps are working, and also too our contact tracers are getting on top of the issues. So we monitor it every day, and we look to see what's happening. And at the moment we're very comfortable, and we've got the large number of testing rates that are happening as well. So people are getting tested, but it's absolutely imperative that if any Queenslander has any symptoms whatsoever, to go and get tested. Don't think, oh no, I've got the flu, I'm going to have a day off. No, go and get tested. This is about keeping the entire state safe. So please go and get tested. Yeah, look, that's a really good question. We put in extra money from memory, about 170 million extra. So that's on top of what we already have put in. We're a really decentralised state, so it is absolutely not physically possible to put in palliative care into every community in Queensland. It's just not physically possible. So we know how important it is. We put that extra funding in, so let's see how that extra funding goes first.
Premier, just on National Cabinet, sorry.
Yeah.
Queensland's next lockdowns have been, 3 days, 4 days. Will you be, advocating at National Cabinet to have those emergency payments for those shorter lockdowns as well? And what else are you advocating for at National Cabinet today?
Yeah, well, that's a really good question, because what we've seen sometimes is that when those 3-day and 4-day sharp lockdowns happen, they work, but businesses still feel the impact of that. Now, in Queensland, the good news is that, the economy is bouncing back. That 5.1% unemployment rate is such welcome news yesterday, especially when, during the pandemic, it was, predicted to be above 7. It's been brought right down to 5.1%. We've got, some of the fastest growth in the nation. But look, it does have an impact on businesses. I appreciate that. So I do think we need to discuss very carefully at National Cabinet is what are those thresholds, because otherwise your 3-day lockdowns will turn into 5-day lockdowns, so businesses can get the compensation. So I do think it's a really delicate situation, but I will be talking about that today.
Last couple, please.
This is new money, Lydia, so we've got to get the money out to people. So look, I know that the Minister for Health is working on that, but let's get that money out first and then see what's needed afterwards. Look, no one wants to see that happen, and I don't know the specifics of that case, but I'm happy to have a look at it. Okay?
Considering the federal
Last one, because I do have to go to an estimates hearing.
considering the federal government has come to the table with a 50-50,
Yeah.
for small business,
Yeah.
is the state government considering its own version of that? Or
I think it has to be in partnership with the federal government. That's imperative, and it's about that the state and the Commonwealth, I think, declaring that yes, those hotspots are needed and those snap lockdowns are needed. And also too, if you have a sharp 3 or 4 day lockdown, you could avoid being in a 30 or a 40-day lockdown. So, I think we've got to get the balance right here, because I think we've demonstrated that when we do go hard and go fast, we actually come out of it better and stronger. So,
And it comes up to those thresholds that you mentioned.
correct. Yeah, I think very good points you've raised.
Thanks, everyone.
Thanks, everyone. Have a nice day, and thanks to Mikey. Thank you. Credit where credit's due. Yeah.